Welcome to the Reverse Mullet Healthcare Podcast by BP2 Health. We're here at the ACLM conference in Orlando, Florida, 2024.
Sunny Florida, 20th anniversary.
Right.
Who are you?
I am Dave Pavlik.
The Mullet Man?
I'm the Mullet Man today.
And I am Ellen Brown.
And I'm Justin Politti.
And we're here with one of my favorite ACLM people, Dr. Patel. And American College of Lifestyle Medicine annual conference, and super excited to be here. I think what's so exciting is we have our little unicorn on the table of always searching for the unicorns of healthcare. And what's so amazing to me about ACLM is like the whole function of ACLM is a unicorn, right? So not only is it like thousands of unicorns walking around, it's also an entire, board certification that really is unicorn status in terms of healthcare. So
I can't tell you how many people that I've talked to that, well, what are you doing? What's the podcast about? And I explain it to them and tell them what we do is BP2. And they go, yeah, I'm almost board certified. I'm sitting for the exam next month. I can't wait. It's like I literally 4 or 5 different people that I talked to just kind of randomly.
Yeah, there's a lot of people studying right now.
There's a lot of buzz, yeah. I know. They're supposed to be studying, but instead they're here.
Yeah. So, Dr. Patel,
it's actually part of the requirement.
That's true. Okay.
Right? So to get the
CMEs as well.
Credits is part of attending this conference.
Very nice.
Oh, I thought you said getting in front of BP2 Health was part of the requirements.
It should be.
It's a new part of the curriculum.
Hold on a second. We just talked to no, never mind. Carry
you're
on.
not going to remember. We talked to a lot of people.
I talked to a lot of people today.
Yeah.
And
it's only day one.
In education, we need to get that on the curriculum.
Oh, Brenda.
Brenda. We need to let Brenda know.
That we're a new part of the curriculum.
Couple of CMEs for maybe one.
Yeah. Just one.
Half of one.
Yeah. You just have to. Yeah. Anyways, without further ado, Dr. Patel, so glad you're here.
Yes, thanks
Which
for
you're a
being here.
very hard woman to find.
Oh, no.
Maybe I can find you, but I can't extract you to get you into the booth. So, so tell us about yourself.
Oh, happy to be here, Alan. You've been someone that I've been following too. So on a social media, and that's how I found you. But
she's not on social media, is she?
Come on, I
haven't seen one
A lot
thing.
of her posts are actually getting viral, as I hear. She has a huge fan following there, so I'm one of those. But no, I think more about how I find that what you actually write on your post on a social media on LinkedIn is something I resonate so much with. And it's like, wow, someone is exactly writing what I'm thinking, right? And so you articulate so well and with so much humor and fun. And so, I think we're kindred spirits here. And
we are kindred spirits. Yeah. And you're the same.
And Ellen was ACLM before she knew what ACLM was.
Yes.
Yeah. I was.
Honestly,
I've been living an ACL dream. It's just like my husband and I took a 1.5-year RV trip before there was van life and before there was blogging. Like it's right. It's like Brenda with her commitment to ACLM before most people knew
She's
about
Forrest
it.
Gump.
I am. I'm like Forrest Gump. I'm like
trendsetter.
Didn't even know it. So so tell us about what you're working on, what you're passionate about.
Yeah. So anyway, but I'm a internal medicine trained clinician and then certified in lifestyle medicine, obviously. So I've had fortunate, as a primary care clinician, we all go through the same sort of journey of, getting tired of doing this more of the same. And fortunately, I found lifestyle medicine that literally changed my personal and professional trajectory. I would have retired from healthcare if I had not found lifestyle medicine. And I don't think I'm the only one saying that. There are so many clinicians here. Either they are burned out, from doing what they do, or they're looking for another avenue to find how can they deliver meaningful care and find purpose and meaning along the way, right? So this is what lifestyle medicine delivers. And I'm so delighted that I had the opportunity of delivering and establishing a program at a local health system in Midland, Texas, where I developed many of this intensive therapeutic lifestyle program. And what really changed me the most was more around the transformations that I actually witnessed. I saw people, like some of my patients early that, they came back as a follow-up and I didn't even recognize them. It was like
that kind of a transformation. After what period of time?
In 3 months.
3 months,
yes.
Wow.
Yeah, 3 months patients completely getting off their medications. If they were on insulin, reversing their diabetes, reversing their cholesterol, hyperlipidemia, and things like. So this is not what we had seen, or at least I had seen in my traditional primary care practice, right? So that's brought me all the passion and excitement. Wow, can we do this? How can I do this and more of it, right? Like, I didn't want to just practice my own clinic. I wanted to actually have that impact, bigger impact. So I aligned with the local health system. And then now I'm so excited to be part of this bigger community here at ACLM, and in my leadership role, I want to replicate more of the success that I've actually seen in my private practice and with health systems, to really see how we can do this like on a bigger scale, right? So that's my big agenda, even as I step into my leadership role within ACLM, is to really demonstrate the value proposition of lifestyle medicine across different payment models.
Can I hug you? Hug you. I think this is the first time I've ever hugged a guest.
She does. She usually
gives a fist pump, but like that was just hug worthy right there. Like, this is why we are meant to be friends.
In your example, I'm sure there are many of a patient that, you know, came back 3 months later and you didn't recognize them. What are the interventions you're deploying that are lifestyle medicine related? All of them, some of them. What works the best?
You know, so early in my private practice, I didn't have the resources to really bring in team-based care. You know, in your private practice, you don't have the resources. No. You can't afford it in fee-for-service payment models. So a lot of that relied on just educating them, providing them some pamphlets, educational material, or websites, or, you know, so I had actually a prescription that we would give them. So, you know, watch this video, look at this website, here are the recipes, you know, all these stuff that we give and they go home. And, you know, those who were really motivated would continue, but there was no support system early on. Clearly, then I realized that there needs to be a very structured program, and we needed to integrate health coaching, bringing into behavioral aspect, and also bringing nutritional counseling with a registered dietitian. And so that's why I joined a health system to bring around this entire interdisciplinary team-based care as part of our approach. But I have seen, so for example, is in my community, I co-founded with another nonprofit called Our Healthy City. So our biggest mission there is to more around educating community around the benefits of whole food, plant predominant dietary pattern and lifestyle medicine. We would conduct, and we still do, annual food as medicine event. And we would have about 500 members from our community just come listen to one-day seminar. We would invite all this big, you know, professionals and speakers from around the world sometimes. But the key is that they just learned, they heard about it, they watched some presentations, and then they go home. And we've seen people losing 70 pounds, 80 pounds on their own, right? Without any further...
They just got motivated from a one-day event.
Yeah, that's what I'm saying. So there are many ways to think about this. It's not everyone needs to have a structured medical program. There's a community element is equally important for support and education. And so all of these pieces have to be plugged in together. Even for many of our intensive programs, yes, we can demonstrate good outcomes. But if we don't have an ongoing support in the community, it's very hard to sustain that.
Keeps coming up.
Yeah.
Community.
Yeah. So
community,
that's the key here is to talk about lifestyle medicine is not just what happens in an office setting.
Yeah.
Right.
Yeah.
It's much more than that. And you can see it here, right?
Yeah. I mean, very much so.
The models that we see, it's across. And so my passion and excitement comes from, it's not just, I mean, predominantly primary care, we want to integrate lifestyle medicine across the board, but we also have it in specialty care.
Which is amazing.
We have it in different settings, right?
Yep.
Inpatient, outpatient, you name it.
Yep.
And across different payment models. So it's like ubiquitous. It can be anywhere, right? And so that's the beauty of this foundational care that we talk about.
Yeah.
So what are some of your thoughts on You mentioned scale a little earlier. What are some of your thoughts on how you can scale this across the country?
Yeah. So when COVID-19 happened during the pandemic, I had a program which was, in-person intensive group program. And obviously we couldn't gather, right? So I had to put that program on a virtual platform. And I had no idea how that would work. I was actually very nervous. I'm like, how are we going to, how do you motivate? And, all of that. And then first group, there was this person, one of my patients who lost like 40 pounds in 10 weeks. His hemoglobin A1C dropped from 7.9 to like 6.2.
Wow.
Just a dramatic change. And he convinced me that virtual model can be equally effective. And then I continued doing in-person groups versus virtual groups, and eventually published a study as well that the outcomes, clinical as well as biometrics, all of them exactly same. There's no difference. So that gives me hope that lifestyle medicine is really it doesn't have to be limited within, there is a huge component. Exactly.
Intensive.
There is a clear model that can be delivered across virtual platform, and that's what we need to do.
Yeah, totally agree. Yeah. I mean, one of the things, I really believe is we have to get away from, like, if you think about sick care as sick care and you think about healthcare as healthcare, I think when we talk about healthcare, this obsession or attachment to bricks and mortar, it becomes, it's unsustainable. It's too capital intensive. It doesn't have the kind of economic model that makes sense. And, especially when we talk about lifestyle health, lifestyle disease and lifestyle health, the thing that has really struck us is in every conversation, I think, except two, the whole group visit model comes up, right? Because it's this, again, it goes back to Justin's question about scale. Yep. So we have to solve for a clinician shortage and for just access and also for administrative burden, all of those things. And then you add the group model. Not only does it solve that whole component, it also adds that pillar of community.
Yes.
And which is something we're sorely missing as a society. And even more so, we spoke to some clinicians today that are focused on equity in like rural. And, they said it's the isolation that exists in rural communities, especially, right? That group model. So it's amazing. And again, it makes all the sense. That's what blows my mind about lifestyle medicine is it's so simple.
It is. And I tell you, that's part of the problem. Also, sometimes I think early on, when I learned about ACLM and the messaging around, is that it's too simple. It is so simple that people don't take it seriously.
How could this be real?
Yeah. How can it be real? And
wait, exercise and eat better?
Sleep.
Stay
be
away
mentally
from all
healthy.
these bad
Like
foods.
don't
stay away from poison.
Drink all the time and smoke and what?
Huh.
Yeah. So I think we are intentional now in terms of how we communicate lifestyle medicine, and we're talking more about the value proposition, right? What exactly it brings, which is the quintuple aim of healthcare. And so we're making sure that people get the value and what it is, not just how we deliver lifestyle medicine, which is the 6 pillars, which is how we deliver, but what exactly is the outcome?
Agreed.
That's what we need to talk about.
You know me, I am convinced that lifestyle medicine is going to be, it could be the solution, one of the core solutions and bridges to taking that 2 trillion out of the system of lifestyle disease, cardiometabolic syndrome, because we already have a whole workforce of clinicians they're already clinically board certified. And so to be able to train them additionally, right, to complement what they're already doing, to say, hey, I think the piece you pointed out that we have to do is we have to move the needle on the economic model. We have to realign the incentives. We have to, and then that money can be redistributed.
Absolutely.
And that's our champion is, this is value-based care.
That's what we're starting to implement and payers are coming around. They are, like, each one's always in its own spot, right? Yeah. But the reality is, you pay for the intervention and then you pay for the progress that you're making, right? So to Ellen's point, it's an incentive-based component that's recognizing, hey, you know what? You're getting paid for the reductions in metabolic, improvement in metabolic function along the spectrum. So to me, that's a fairness piece, because right now,
they share the savings.
The danger is, all right, you put this in, and then it accrues directly to the insurance company without any
Exactly.
without any credit going to
Exactly.
the
And I
people
think
who are doing it right.
you so well said. All of us have delivered lifestyle medicine and very successfully, and it didn't matter because it was in fee-for-service world,
Right.
right?
Right,
Exactly. Nobody cares about the
Exactly.
quality, cost saving, outcomes. Nobody cares. It's just the episodic billing and collection is all
Yep.
that everybody cares.
Productivity and- yeah.
It's a number. But as you said, payers are coming, recognizing the value. As I don't know if you attended, but we had a panel discussion earlier today. And for the first time in the history of ACLM, we had two major payers on the stage.
We went in and watched.
For
Yep.
me,
And-
that says a lot. That
Yep.
the change
And I
is
have two of them
happening.
tomorrow.
Okay, great.
I think.
Yeah.
So we had Susanna Bernheim, which is the acting CMO of CMMI, which is the
Yep.
CMS Innovation
Yep.
Center, and we had Kate Goodrich, CMO of Humana, and we've been working with these two big pairs for some time as part of our Innovators Council and otherwise. So it's a groundswell, right? It's a real exciting time for the field to see so much interest from payers, and they recognize this. And I think all these things that we hear about, whether it's employers, having to pay so much for their benefit plan next year, what 7 to 8% increase, or whether it is this AMA plans, going through the headwinds,
The
and
95% of CA.
V28.
Whoops.
I think these are all wonderful opportunities for lifestyle medicine to thrive, right?
Totally.
This is exactly where we need to insert lifestyle medicine as a solution because it has the potential to.
No, it is an ultimate solution. So
Think of that. Get healthier. There we go.
So you were in private practice and then you went to work for a system in Texas.
Yeah.
And so was the leadership always kind of behind this lifestyle medicine in terms of the finances? We need dietitians, we need this staff, we need that staff. It's going to cost you, but in the long run, it's going to be.
No, so what was interesting is that it's a safety net hospital in a small community.
Okay.
And we had really defined our vision, mission, and values to make Midland the healthiest community in Texas. So the way we approach lifestyle medicine was more of a broader solution, right?
Okay.
Strategy, like how are we going to get there? So initially, where I started was what are the pain points for my health system, right? Looked at that, and well, as a self-insured entity, they were paying almost $3 million more than the budgeted amount every year. So we said, okay, let's do something for the employee health.
Mm-hmm.
And so in about a year of intervention, which is the same intervention, we keep talking about intensive therapeutic lifestyle change program, which is a group medical visit, and had about 150 employees that go through that intervention. We demonstrated $3 million cost savings, right? Wow. So that opened
There's your
our
budget
world.
right there.
Yeah.
Okay, we proved the model ROI because you have to do the business, and otherwise, it's hard to change that needle here. And in support, I think so. One was this alignment with their overall goal. Second, we demonstrated the ROI, and the third was that we wanted to create a program that would lifestyle medicine program that would create a robust payments model. So with a reimbursement structure, which was this intensive cardiac rehab that we brought. So we brought the Ornish program initially, and then later changed to Pritikin intensive cardiac rehab. But it brought revenue to my lifestyle medicine center, which allowed me to develop new programs, hire more staff, so I went about not opening a center first, but I went about looking at, okay, what are the pain points? Let's solve that, get the confidence of the executives, and then expand and create revenue first before you talk about opening a center. So all of these kind of come together.
That's great. I think it's great that the mission is to have the healthiest community in Texas, and cost isn't going to be a barrier. Let's figure it out.
Yes.
That's impressive. Yeah.
yeah, it's amazing. So we could talk for like a long time. And I know that you're
And there could be
needed
many
to
more
like
hugs.
continue to circulate. Yes, there will be many more hugs. Yes, because we are going to do some big stuff. We
Yes.
are here to try to help. You know, we're completely committed to this. And
Thank you.
and-
Thank you. No, I think thank you for being here this year. This brings a sort of a new excitement among our members. You know, all of them passing through. It's
yeah,
like,
they're
"Hey,
like, wait,
on?
what's
Can
in
you
there?
tell
There's
me?"
like bright lights. And what is this?
I've got them in my head categorized as podcast curious
Yes.
and podcast serious.
Oh,
So the curious ones kind of go by, they look in, they're like, I'm a little not sure I want to get behind that camera over there. And then the serious ones are like, where's your sign up
well,
sheet?
but
Yeah.
my favorite are the ones that are like just sort of come in.
Oh,
Yeah.
And it's like, hi there. Like, all
Grab a
right,
microphone.
Well, let's just sit down and go. So
Here's a coffee and a mic. Let's go.
Tomorrow we've got a jam packed. I think we have
Yeah.
to start like putting blocks so we can actually go get some water, you know, but
Oh,
And I do think
well,
we
good
are.
luck.
I think we're going to have at least one of those payers you referenced, right?
yes,
Yeah.
I think so.
Yeah.
We're
Maybe
good.
two.
That's
Maybe
the
two.
rumor.
Yeah.
That's the rumor on the street.
But yeah, so super excited you took the time
Yes,
to come
thank you
on.
so much.
Thank you.
and
Thank you.
You will certainly be part of a full
And keep
episode,
doing
you know.
the great work you're doing.
Thank you.
We
I
will.
appreciate
She
it.
will,
We
for sure.
Yeah.
You make sure she does.
Right.
Well, I'll make sure she does. Don't worry. That's an easy task.
Just don't make me do it, right?
Yeah, exactly.
All right. Well, thank you.
Thank you
All
so
right.
much.
Have a
Enjoy the
great
rest
day.
of the conference.
Thank you.